Hi, good afternoon. This is Aubrey and Jordan with Education, and today we are talking to you about how to administer respiratory therapy medication, starting with a meter dose inhaler. So with the meter dose inhaler, you have a dry medication that's going to be delivered into the lungs through deep inhalation. What's important to know is that if your patient is not able to take a very deep breath and inhale this medication in, you need to talk to the provider and see if there's a better mode of an administration that would be more appropriate for your patient. With inhalers, you want to make sure that you always check that they are in date and that they have adequate medication still remaining in the chamber. If they are close to running out, you may want to go ahead and request another inhaler instead of getting really close to that last dose. And then also make sure that we are teaching the patient adequate oral therapy, because these medications do put them at high risk for developing oral infections, including thrush. So after they take their medication, they need to swish and spit out. There are a couple of ways that the medication can be administered. You can either take it directly from the inhaler, which will look like this, or you can use a spacer. The spacer is typically going to be used for patients who have a hard time forming a really good seal on here and holding their breath after they inhale. With the spacer, you don't have to hold your breath after you inhale the medication. So we'll start first with just the inhaler. So you'll make sure that you take the top off. You're going to shake it really well to mix the medication. Put the inhaler in your mouth, and then tell your patient you want them to exhale everything from their lungs. Put their lips tightly around the edge of the inhaler, and then depress to administer the medication as they deeply inhale over 3 to 5 seconds. Once they do that, they need to hold their breath for about 10 seconds while the medication absorbs, and then they can slowly exhale. If they are taking more than one puff, you want to let them have about a 5 to 10 second break in between so that they don't become hyperventilated. If your patient is going to be using a spacer, which is available in the respiratory supply closet, it's going to look like this and come in a plastic wrapper. You take it out of the wrapper. This back hole right here is where you fit in your inhaler, and then take the mouth guard off. Same protocol. You're going to have the patient exhale everything out of their lungs, put the mouthpiece in and tightly seal their lips around it, and then depress the medication plunger to expel the medication. And then they're going to breathe slowly and deeply 3 to 5 times to inhale the medication that's in the canister. They don't have to hold their breath at any time. When they take it back out, then they can just breathe normally. With either method, if you see them exhale and see mist coming out of their mouth, that typically means that they didn't time the inhale process correctly with the time that they push the plunger down on the inhaler, and they didn't get the benefit of the medication, so then you may want to have them do an additional puff. And with this medication, you want to make sure that you rinse out the canister after every use, and also wipe down the mouthpiece to prevent them from having an infection or bacteria growth. You also need to make sure that you are wrenching in the correct charting piece for this. So you're going to have to add in a flow sheet if you haven't already got it on your screen. You're going to go to the flow sheet page, and you're going to search for respiratory. Make sure you select facility list instead of just preference list. And it's going to be the RT assessment page. So when you go into that spreadsheet or that flow sheet, it's going to ask you to add in, just like we would with any other entry, the time that you did the treatment. It's going to want to know whether it was the original treatment, the initial, or a subsequent. What kind of delivery device, the route, heart rate, respiratory rate, patient status, how they were positioned, while they tolerated it, and what their breath sounded like. It will walk you and prompt you through each of these. You need to do this prior to administering the treatment and after administering the treatment. Once you have given this treatment and wrenched this flow sheet in, it should then show up every time you log into the patient's chart. If you have any questions, please reach out to us. Thanks so much.